Macular degeneration can be defined as the different age-related changes that are occurring at the macula of the eye. Now, what is the macular region, or what is the macula that we're talking about right now? Macula is the spot at the retina which is responsible for the central vision of a person. So it is basically bilaterally located both in both eyes, right and the left, and it can basically pace differently. These degenerative changes can pace differently in both of the eyes according to the age of the person. It can be related to the age of the person that these degenerative changes are occurring, and again there are the other causative factors that can again cause the macular degeneration, macular atrophy, or it can be exudative changes that are taking place at the macula of the person. So this is the scenario that we're going to discuss over here. Usually, you'll get a patient who is in the older age group, that is obviously in the 6th, 7th, or the 8th decade of life, and he or she will be presenting to you in the outpatient department with a history of the chronic vision loss, which started obviously as a visual field defect, mostly located in the center of the eye. So this is the center of the vision. So this is the common presenting complaint. One and foremostly, the person will be giving you a history of a chronic vision loss, and secondly, the visual field defect would be located centrally. These are the two major factors that we are considering at this time. We have to keep in mind the differential diagnosis of the chronic vision loss. We have studied the glaucoma factors. The intraocular pressure is raised in the glaucoma, and that is the causative factor for the chronic vision loss, which starts off at the peripheral visual fields. So this is again very important factor that you distinguish glaucoma from the macular degeneration. Again, you will have an aged patient, you will have a patient which is in his senile age group, and you're going to distinguish between these glaucoma, cataract, and then the macular degeneration. These are the differential diagnoses, the three most commonest reasons for a chronic vision loss in a person. When we are dealing with these patients, one should know how to distinguish glaucoma from cataract, and then cataract from macular degeneration. This definitive diagnosis is very important and is obviously based upon the clinical examination of the person as well. We have studied the different factors in which the intraocular pressure is risen to the levels of more than 20 millimeters of mercury in cases of glaucoma. Then in cataracts, we can see the cataract, the opacity of the lens is seen quite visibly. When we have these patients of cataract and they are examined, the red reflex is absent in these patients. We have that opacified lens that can be visualized. If it is a mature enough cataract, we can diagnose this very commonly clinically. Macular degeneration can only be diagnosed if we have the fundoscopy performed in a proper way. There are these particular changes when we perform fundoscopy. You can see the proliferative changes occurring at the retina. And then we have one should know how to distinguish between the optic disc and the macula, that I'll be showing you later on in this section. And then you should know how to distinguish these normal macula from a macula with macular degeneration. So these are the changes that occur along with the age, and there are different types that can be related to this macular degeneration phenomena. Majorly, we discuss or we divide or categorize these macular degenerative changes into two basic types, that is the dry variety, and then we have the wet variety. The dry variety basically comprises of the atrophic changes, and then the wet variety of the macular degeneration is basically referring towards the exudative changes due to the inflammatory processes or due to the infections that can occur, and that can again damage the macular structures. So first of all, we'll be defining these macular changes, this macular degeneration over here. How do we go about and define this condition is very important. And then we'll be discussing the different types of this macular degeneration which we can observe in the patients. The pathophysiology, that is, what are the changes that are basically leading towards this macular degeneration? At the cellular level, at the histological level, that we'll be discussing over here in this very first section. So this is a diagram which is basically focusing on the age-related macular degeneration that is occurring. It is the retina, it is a normal retina, can be observed over here. You can just focus on these factors that we have the optic disc that is shown on the right, and on the left we have the macula in the center. So these are some of the changes, the degenerative, these proliferative changes that are occurring in the normal retina. Obviously, we're going to observe these changes on the fundoscopy or the ophthalmoscopy. When it's observed the basic baselines for performing these ophthalmoscopy, you ask the patient to look at a distant object and he's going to constantly look at that, and then you're going to focus your ophthalmoscope and observe the retinal structures of the eye. Then you're going to come close towards the eye and the retina is clearly visible. You can visualize the optic disc. The fovea centralis can be visualized. Then the pallor of the optic disc is very important. The macular degenerative changes are again very important over here to observe. So this is the macula. The arrow is basically pointing towards the macula. The atrophic changes have to be distinguished from the exudative or the wet variety of the age-related macular degenerative changes that we're talking about over here. So the aging changes, as we were already focusing on this factor, that they can be divided, or the types of the macular degeneration that we clinically observe is one of the major varieties is the wet variety, and then we have the dry variety. The dry variety is basically referring to the atrophic changes in which we do not observe a lot of exudates accumulating in the retina. No proliferative changes, no cotton wool appearances are observed in this kind of macular degenerative form. And then we have the wet variety in which we have the proliferative changes. We have the cotton wool appearances specific to this kind of the macular degeneration, and obviously exudates are also observed in the retinal structure. So this is these are the basic two categories. One is the dry variety of the macular degeneration, and on the other hand we have the wet variety of the macular degenerative changes over here. So this is the macular degeneration. If we look at it, you can observe that there is some exudates that are present around the macular region. This pallor, that we are basically focusing on over here. Over here, you can see this pallor structures that are just surrounding this macular region, and even inside the macula you can observe this discoloration, and that is basically relating towards the age-related macular degenerative changes that are taking place. Now the pathophysiology, you can just have a look over here that we see that this is basically the macula over here. The optic nerve and the optic disc can be observed over here. This is a normal retinal structure. We have this Burke's membrane over here. These are the retinal structures. These are the structures that we've already discussed, involving the cones and the rods that are basically responsible for the accommodative changes and even the adaptive changes that occur when basically the dark adaptation or the light adaptation that is responsible due to these rods and cones that are present at the base of the retina. Then we have the Burke's membrane, then we have the choroid plexus over here, and the retinal pigment epithelium is just located along the Burke's membrane Over here, you can see the new abnormal blood vessels, they leak the fluid and blood, leading to the vision loss in the Burke's membrane. So this is the change that basically we have the abnormal blood that is coming from the choroidal plexus that is located at the base. This is a normal retinal structure, and this is a deranged retinal structure due to the proliferative changes and due to the exudates and the leakage of the fluid and the blood that is leading to the loss of vision due to the fact that the retinal structures are also getting detached at this point, and obviously the vision is also going to be affected. If it's occurring at the macula, it is going to be affected. So this is the basic pathophysiology, or the events that are basically responsible for the chronic vision loss. Again, there is a central kind of a vision loss that we're talking about over here. Talking about the varieties that we've already talked about, this is a normal macula. Then we have the wet macular degeneration, in which we can see the exudates, the fluid or the blood that is accumulating in the macular region. And then we have the dry macular degeneration, in which we just observe the atrophic changes that are taking place, but no exudates or no blood is accumulated at this level. Over here, you can just observe the location of the macula. This is the optic disc where the optic nerve is going to enter into the retina, and then we have the macula just situated slightly above this optic disc, or this normal optic disc, or the optic nerve that is present at the back of the retina. So these are the locations that you should be well versed with. Why is it important to know these anatomical structures, and what is the basic location of these structures? Because when you'll be performing the ophthalmoscopy in the patient, one should know where these structures actually lie, because that is how you're going to diagnose any changes that are occurring in these structures. So the epidemiology, when we talk about it, it is quite a prevalent disease. It is a leading cause of the irreversible vision loss in the Western world, and it is usually prevalent in the older age group. That is usually the age group that is mostly presenting along with this macular degeneration is 55 plus. So it's usually in the 5th decade or in the 6th decade of life that you observe these changes. Then we have the dry and the wet forms. The 2/3 of the UK citizens also are suffering from these sort of central vision loss. Then we have the 450 new wet ARMD per million per year. So this is quite a prevalent disease. Obviously, it is more prevalent in the older age groups. And again, we have the special causative factors that are ranging, or that are contributing towards the development of these macular degenerative changes in the older age group patients. The prevalence is almost 4.8% for more than 65 years of age group. Then we have 12.2% for more than 80 years of age group, predicted to increase by 33% between 2010 and 2020. So these are the predictive increase rates that we can see in these patients that we're talking about. The diagnosis is made first of all on the history. So you'll get a patient who is going to give you a history of, again, a chronic vision loss. The visual field that is affected in this kind of patients is usually a central visual field. When you look at the particulars of the patient, you would find that he is belonging to the 5th or the 6th decade of life. So you're going to add macular degeneration into your differential diagnosis at this point. So this is the particular history, or the typical history of a patient who is suffering from macular degeneration. The clinical findings, obviously, you're going to see you're going to examine the eye apparently, then you're going to calculate the intraocular pressure of the person just to rule out glaucoma at any stage, and then you're going to see for cataract, do you see any sorts of opacification in the lenses, or is there some sort of raise in the intraocular pressure? And if you can see if there's an absent red reflex, that is going to point out or clue out towards the cataract formation in the person. So these are the differential diagnoses that you're going to rule out when you're going to clinically examine this particular patient. Then you're going to perform the ophthalmoscopy, and on ophthalmoscopy, for instance, you're going to look for proliferative changes, the cloudy appearances, the macular degenerative changes, It can be, you have to keep in mind that it can be a wet variety and then it can be a dry variety, which involves just the atrophic changes, and no exudates are formed at this point in this type of macular degeneration. So these are the particular clinical findings that we're going to see in this kind of a patient. The differential diagnosis for a chronic vision loss, it basically includes the cataract, glaucoma, macular degeneration. Then we have the degenerative macular detachment. That is again one of the chronic causes of the vision loss in a person. May it be unilateral or even it can be bilateral. So these are some of the causes. Then we have the diabetic retinopathy, which can also be included in the differential diagnosis of the chronic vision loss. So these are some of the differential diagnoses that we have to keep in mind. We have to rule out one by one all of the diseases and get to a definitive diagnosis in a patient of a chronic vision loss. The diagnostic imaging is very important over here. We're going to look over here at the different degenerative changes that are taking place over here. The view of the posterior pole that we have to focus on, this is the macula, this is the fovea, and this is the optic nerve over here. So the most central portion of the macula is termed as fovea centralis that we talk about. And over here you can see, in case of macular degeneration, what are the clinical findings? It can be the subretinal hemorrhage in case of the exudative form of the macular degeneration. It can be the atrophic changes, and then we have the Drusen formation. Drusens are another names for the exudates that can be found on ophthalmoscopy, and that are again going to point out towards the macular degenerative changes. Over here on the right, you can see this is a normal vision of a person, and this is how it would look for a person of macular degeneration. The central visual field defect would be present in cases of macular degenerative changes when we see them. So the visual acuity is going to be markedly reduced. Again, the patient would give you a history of a chronic vision loss rather than an acute kind of a vision loss in this particular patient. Ophthalmoscopy has to be performed. And obviously, all of these changes, the definitive diagnosis is going to lie upon the findings of the ophthalmoscopy or the fundoscopy that is being carried out. Then the angiography of the vessels can also be carried out. The ocular coherence tomography is one of the techniques that can be used for the diagnosis of macular changes or the macular degenerative changes. The others, for example, other tests that can or cannot be performed if you have concluded up to a macular degenerative cause, then if needed, these tests can be performed, for example, electrophysiology. Then we have the newer technologies or the newer testings that can be performed in this patient. So this is usually the chart that is given for the diagnosis of the macular degenerative changes in a person, that is basically focusing on the visual acuity that is affected in these people. Usually the visual field defect would be more of a central kind. The visual acuity is going to be decreased in the patient. The patient is going to give you a history of a chronic vision loss or the visual acuity that is decreasing on a longer time periods. So this is these are the findings that we're going to see clinically in a patient of macular degeneration. So over here in this section, we focused on an overview that was given for the macular degenerative changes, the different clinical types that we basically categorize the patient into, because the treatment is going to lie upon the fact that what type the person is suffering from. So this is the end of this section. Thank you for watching sqadia.com.